A lower urinary tract infection is an infection of the urethra, the bladder, or both. The urethra is a tube that carries urine from the bladder outside the body. The bladder and the urethra are part of the urinary tract system. That is why a bladder infection is also called a lower urinary tract infection. If you have a bladder infection, you often feel a burning sensation while urinating and a pressure or painful sensation in the lower abdomen. You often feel that you have to urinate, but not much urine comes out during urination. The urine may have an unpleasant smell and may sometimes have blood in it. The most common cause of a bladder infection is a bacteria that infects the bladder mostly through the urethra. There are different factors that increase the chances of a bladder infection, which goes along with increased risk of bacterial infection. Not enough fluid intake, sexual intercourse, bad hygiene, bladder or kidney stones, pregnancy, menopause, diabetes mellitus, if you have a catheter, birth defects of urinary tract or kidneys. Chemicals. Women have bladder infections more often than men because women have a shorter urethra, causing easy entry of bacteria from outside into the bladder. Even though it is often thought, it's not likely that a cold or draft can cause a bladder infection. A bladder infection is an annoying and painful complaint that in general can be treated well. The GP may prescribe antibiotics to speed up the recovery of a bladder infection and prevent complications like an infection of the ureter, kidney, pelvis, etc. To prevent bladder infections, it is important to drink 2 liters of water daily. Frequent urination washes out the bacteria. Don't resist the urge to urinate, but go to the bathroom as soon as you feel it. Always make sure to completely empty the bladder when urinating. For some women, a bladder infection recurs less frequently if they urinate after having sex.